Look at this photograph. Take a moment. Really look at it. It's a wedding portrait from 1890, taken in the studios of Harrison and Sons on Elm Street in Providence, Rhode Island. The image shows what appears to be a joyful bride and groom, captured in that formal, rigid pose so characteristic of late 19th century photography. The bride, whose name was Eleanor Whitmore, sits in an ornate chair upholstered in dark velvet. Her dress is magnificent, layers of ivory silk and French lace that would have cost her family a small fortune. The groom, Thomas Edward Hartwell, stands beside her with his hand resting on the back of her chair, his expression serious but not unkind, as was the fashion of the time. At first glance, everything about this image speaks of prosperity, of normalcy, of a young couple beginning their life together in an era of American optimism and industrial expansion. But look closer. Look at the bride's left hand, the one that should be displaying her new wedding band, the one that rests so delicately on the arm of that velvet chair. You're seeing it correctly. That is not her hand. That cannot possibly be her hand. And yet, according to every piece of documentation we have, every medical record, every testimony from the dozens of people who witnessed what happened to Eleanor Whitmore in the months following this photograph, that is indeed her hand. What you're looking at is completely, utterly impossible by every standard of medical science we possess, even today, more than a century later. And the story of how that hand came to look the way it does, the story of what happened to Eleanor Whitmore between her wedding day and the moment this photograph was taken, is one that will challenge everything you think you understand about the limits of human physiology. This is that story. Eleanor Whitmore was born on March 14th, 1868, in Providence, Rhode Island, to Jonathan and Margaret Whitmore. Her father owned a successful textile mill on the Blackstone River, one of many such establishments that made Providence a center of American manufacturing in the decades following the Civil War. The Whitmores were not wealthy by the standards of the Vanderbilts or the Astors, but they were comfortable, respectable members in good standing of the First Congregational Church, donors to the Providence Athenaeum, the sort of family whose daughters received proper educations and made appropriate marriages. By all accounts preserved in letters held at the Rhode Island Historical Society, Eleanor was an intelligent, vivacious young woman. Her former schoolteacher at the Providence Female Seminary, a Miss Adelaide Porter, described her in an 1883 letter as having an exceptionally quick mind and a talent for watercolor painting. Eleanor's own letters from this period, written to her cousin Martha in Boston, reveal a young woman excited about life, curious about the world beyond Providence, interested in the suffrage movement and the reforms being discussed in progressive circles. In the spring of 1889, at a church social organized to raise funds for the construction of a new orphanage, Eleanor met Thomas Edward Hartwell. Thomas was 27 years old, 3 years Eleanor's senior, and worked as an engineer for the Providence and Worcester Railroad. He came from a similar background, solid middle class, educated at Brown University, a young man with prospects and ambitions. Their courtship, documented in the society pages of the Providence Journal and in Eleanor's increasingly frequent letters to her cousin, proceeded exactly as such courtships were expected to proceed in that time and place. They were engaged on November 2nd, 1889. The wedding was set for June 14th, 1890. Everything was proceeding normally. Everything was exactly as it should have been. Then, in late February of 1890, approximately 3.5 months before the scheduled wedding, something changed. The first indication that anything was wrong appears in a letter Eleanor wrote to her cousin Martha, dated February 23, 1890. The letter is preserved in the Martha Whitmore Correspondence Collection at the Massachusetts Historical Society, and the relevant passage reads as follows. Eleanor writes, "I have been experiencing the most peculiar sensations in my left hand these past several days. It begins as a tingling, not unpleasant at first, rather like the feeling one gets when one's hand has fallen asleep. But then it progresses to something else entirely, a sensation I can only describe as movement beneath the skin, as though something within were rearranging itself. I have told no one, as I fear they would think me hysterical or imagine I had taken ill. The wedding preparations continue, and I dare not cause alarm. She mentions the sensation again in a letter dated March 1st. The feeling persists and has grown stronger. I find myself unable to wear my gloves comfortably, as the left one feels too tight across the palm and fingers, though I know this cannot be true as I have worn these same gloves for 2 years without difficulty. There is no swelling that I can see, no redness or other sign of injury or inflammation, and yet the hand feels different, changed in some way I cannot adequately express. On March 7th, 1890, Eleanor's mother, Margaret Whitmore, wrote to her sister in Newport, Rhode Island. That letter, also preserved in historical archives, contains the first indication that the changes in Eleanor's hand had become visible to others. Margaret writes, "Eleanor has developed the strangest condition in her left hand. At first I thought she had injured it somehow, perhaps caught it in a door or burned it on a stove, but she insists she has done no such thing. The skin appears unchanged, no bruising or burns, but the shape of the hand itself seems somehow different, particularly in the fingers. Our family physician, Dr. Morrison, examined her yesterday and pronounced himself baffled. He has prescribed rest and cold compresses, though he admits he has never seen anything quite like this before." Dr. Richard Morrison's medical notes from that March 7th examination still exist in the archives of Rhode Island Hospital. His handwriting is precise, methodical, the notes of a careful practitioner trained in the best medical schools of his era. He writes, "Patient presents with complaint of altered sensation and apparent morphological changes to left hand. Upon examination, the hand appears longer than the right by approximately 1/4 inch, though patient insists no trauma has occurred. Fingers demonstrate unusual flexibility. Range of motion exceeds normal parameters. Skin integrity normal. No inflammation, no fever, no signs of infection or disease process. Patient reports no pain, only continued sensation of internal movement. Diagnosis uncertain. Have recommended rest and observation." Rest and observation did nothing. Over the next 6 weeks, the changes accelerated. Eleanor's letters to her cousin become increasingly distressed, increasingly detailed in their descriptions of what was happening to her hand. On March 21st, she writes, "The hand continues to change. The fingers have grown distinctly longer, and I can now bend them in ways that should not be possible. I demonstrated this to Mother yesterday, and she became so upset that I resolved not to show anyone else. Thomas knows only that I've been unwell. I have taken to wearing gloves at all times when he visits, claiming my hands are cold. The wedding is less than 3 months away, and I am terrified. By early April, the changes have become impossible to hide from those closest to her." Margaret Whitmore's letters from this period document a household descending into quiet panic. She wrote on April 5th, "Eleanor's hand has become grotesque. There is no other word for it. The fingers are now a full 2 inches longer than they should be, thin as spider legs, and they move with a fluid, boneless quality that makes me ill to watch." She has taken to binding the hand in bandages, telling visitors she's suffered a burn, but I do not know how long we can maintain this fiction. Jonathan has consulted with 3 additional physicians, each more baffled than the last. Those consultations are documented. Dr. Samuel Henderson, a specialist in nervous disorders practicing in Boston, examined Eleanor on April 12th. His notes describe what he calls an unprecedented case of spontaneous tissue modification. He writes, "The affected hand demonstrates characteristics I have never before encountered in medical literature or practice. The bones themselves appear to have lengthened and thinned. The joints possess extraordinary flexibility. Most disturbing, the process appears to be ongoing. I observed visible changes in the length of the index finger during the examination itself, an elongation of approximately 1/8 of an inch over the course of 45 minutes. The patient reports no pain, no illness, only the continued sensation she describes as internal rearrangement. I can offer no diagnosis, no prognosis, and no treatment. This is beyond my understanding." Dr. Henderson recommended that Eleanor be examined by Dr. Josiah Warren, a prominent physician who had studied at Johns Hopkins and maintained an extensive practice in New Haven, Connecticut. Dr. Warren saw Eleanor on April 19th at his private clinic. His examination lasted 3 hours and included detailed measurements and the creation of several plaster casts of both hands for comparison purposes. Those casts, remarkably, still exist in the War Medical Collection at Yale University's Cushing Center. I have examined them personally. The difference between the two hands is shocking even in cast form. The left hand is elongated, the fingers extraordinarily long and thin, the palm narrowed and extended. It does not look like a human hand. It looks like something approximating a human hand, something that has taken the basic template and stretched it beyond all normal proportions. Dr. Warren's written assessment, filed on April 23rd, makes for disturbing reading. He writes, "I have examined Miss Whitmore's affected hand with the utmost thoroughness. I have measured it, photographed it, created plaster reproductions, and consulted every medical text in my considerable library. I can find no precedent for what is occurring. The hand is not diseased. It is not injured. It is not the result of any growth or tumor. It is simply changing, transforming, elongating in a manner that violates every principle of anatomy and physiology I spent 30 years studying. The bones are lengthening. The tissues are extending. The transformation is active, ongoing, and appears to be accelerating. Miss Whitmore is quite literally growing a new hand, or rather, her hand is growing itself into something other than what a hand should be. I cannot explain it. I do not believe anyone can explain it. But here is what makes this case even more disturbing. Eleanor Whitmore did not cancel her wedding. Despite everything that was happening to her hand, despite the doctor's bafflement, despite the visible ongoing transformation that was making her left hand longer and stranger with each passing day, Eleanor insisted that the wedding proceed as planned. Her letters from late April and early May reveal a young woman caught between horror at her condition and an almost desperate need to maintain normalcy, to proceed with the life that had been planned for her. On May 2nd, she wrote to her cousin, "Thomas has been told. He insisted on knowing the truth, as I could no longer hide the bandages or excuse my refusal to remove my gloves." I showed him the hand. He looked at it for a long moment, and I could see in his face the same revulsion I see in the mirror each morning. But then he took my other hand, my normal hand, and told me that whatever was happening, we would face it together. The wedding will proceed. I will be married in 5 weeks, monster hand and all. The word monster appears several more times in Eleanor's correspondence from this period. She was increasingly viewing herself as something other than fully human, something transformed and grotesque. Yet the wedding preparations continued. Invitations were sent. The church was reserved. Eleanor's wedding dress was completed by a seamstress who later told the Providence Journal that she had been instructed to make the left sleeve slightly larger than the right, though she was not told why. On June 10th, 4 days before the wedding, Eleanor was examined one final time by Dr. Morrison, her family physician. His notes from that examination provide the most detailed description we have of the hand's appearance at this stage of its transformation. He writes, "The left hand now measures 9½ inches from wrist to tip of middle finger, compared to 6¾ inches for the right hand, an increase of nearly 3 inches. The fingers are extraordinarily elongated, each segment lengthened proportionally so that the overall structure remains hand-like, but profoundly abnormal. The skin remains healthy in appearance, pale and smooth, showing no signs of trauma or disease. The nails have grown longer as well, following the extended length of the finger bones. Most unsettling, the hand demonstrates flexibility far beyond normal human range. Miss Whitmore can bend her fingers backward until they nearly touch her forearm. She can curve each finger into shapes that should be anatomically impossible. When she moves the hand, it has a fluid, almost serpentine quality. I asked her if she experienced pain. She told me she experiences nothing, no pain, no discomfort, only a constant awareness of the hand's strangeness, a sensation that it is not quite part of her, or perhaps that it is becoming part of something else. On June 14th, 1890, Eleanor Catherine Whitmore married Thomas Edward Hartwell at the First Congregational Church in Providence. Approximately 120 guests attended. The ceremony proceeded without incident. Eleanor wore long white gloves, both hands covered, and if any of the guests noticed that the left glove appeared unusually long, they did not mention it in their letters or diaries from the period. After the ceremony, the wedding party and family members proceeded to the Harrison and Sons photography studio on Elm Street for the traditional wedding portrait. This was the photograph I showed you at the beginning. This is where we need to look again more carefully this time, now that you understand what you're seeing. Eleanor is seated, as I mentioned, in that ornate velvet chair. Thomas stands beside her. They are positioned in the formal style of the era, serious expressions, rigid postures. But Eleanor's left hand, the hand that rests on the arm of the chair, is visible. The glove has been removed for the photograph. You can see it clearly now, knowing what you're looking for. The fingers are impossibly long, thin as willow branches, the proportions all wrong. The hand looks like it belongs to something much larger than Eleanor's small frame, or perhaps to something not quite human. It is elegant in its strangeness, beautiful in a disturbing way, but it is undeniably other. The photographer, a man named Charles Harrison, left his own account of this session in a journal that was donated to the Rhode Island Historical Society in 1932, long after his death. Harrison wrote, "I have photographed thousands of couples on their wedding day, but I will never forget the Hartwell wedding portrait. The bride's hand, her left hand, was the most peculiar thing I had ever seen. It was as though God had taken a normal hand and stretched it on some invisible rack, pulling it longer and longer until it barely resembled the human form. She sat so still while I prepared the exposure, and I could see her watching that hand, staring at it as though it belonged to someone else. I asked if she wanted to position it differently, perhaps hide it in the folds of her dress, but she refused. She said, and I remember this exactly, she said, 'It is part of me now, however terrible it may be. Let be seen. Let be documented. Perhaps someday someone will understand.' But understanding never came. After the wedding, Eleanor and Thomas settled into a house on Benefit Street, one of those tall, narrow federal-style homes that still line that historic Providence neighborhood. For the first few months, by all accounts, they attempted to live normally. Thomas went to work each day for the railroad. Eleanor tried to manage the household, though she found certain tasks impossible with her transformed hand. She could not sew, as the elongated fingers could not manipulate a needle with precision. She could not play the piano, which she had loved, as the keys no longer fit properly under her altered hand. She began to withdraw from social engagements, claiming illness, avoiding situations where her hand might be seen. But more disturbing than Eleanor's social isolation was what happened next to the hand itself. In September of 1890, 3 months after the wedding, the transformation entered a new phase. Eleanor's letters from this period, written only to her cousin Martha, and increasingly desperate in tone, describe changes that go beyond mere elongation. On September 8th, she writes, "The hand has begun to develop additional joints. I know how mad this sounds, but I swear to you it is true. The fingers, which are already too long, now bend in places where there should be no joints. I can fold the index finger into shapes that hurt my eyes to look at. The thumb has divided somehow, not split exactly, but as though an extra segment has grown within it. I am terrified to show Thomas. I am terrified to show anyone. I keep the hand wrapped and hidden at all times, but I can feel it changing, feel it becoming something else entirely." Margaret Whitmore's letters confirm this progression. On September 15th, she wrote to her sister, "I visited Eleanor yesterday and insisted on seeing the hand despite her protests. It has gone beyond strange in a territory I have no words for. The fingers seem to have more segments than fingers should have, more places where they bend and curve. The palm has elongated until it is nearly as long as the fingers themselves. Most disturbing, the hand sometimes moves of its own accord, the fingers flexing and curling while Eleanor sleeps. She woke in the night to find it had wrapped itself around the bedpost in a grip so tight that Thomas had to pry the fingers loose. She wept the entire time, saying over and over that it was not her doing, that she had not moved it, that the hand was acting without her will. This loss of control over the hand's movements appears to have been the final breaking point for Eleanor. On September 23, 1890, she and Thomas traveled to Boston to consult with Dr. Harrison Blackwood, a physician who had published several papers on unusual neurological conditions. Dr. Blackwood examined Eleanor at Massachusetts General Hospital over the course of 2 days, September 24th and 25th. His clinical notes from these examinations are preserved in the hospital's historical archives, and they make for profoundly disturbing reading. Dr. Blackwood writes, "I have examined the patient's left hand extensively. The transformation is far more advanced than I was led to believe from correspondence. The hand now measures approximately 14 inches from wrist to fingertip, more than twice the length of the patient's right hand. The fingers contain not the normal 3 joints, but what appear to be 5 or 6 articulation points each, allowing for movements that should be anatomically impossible. The bones, which I examined through careful palpation, feel thinner than normal bones, but somehow more flexible, as though they have taken on properties of cartilage. Most disturbing is the patient's report of autonomous movement. She states that the hand now frequently moves without her conscious direction, that she experiences its movements as though watching another person's hand, that she sometimes wakes to find it has grasped objects or positioned itself in ways she did not intend. I observed this phenomenon myself during the examination. While the patient sat still with her eyes closed, the fingers of the affected hand began to flex and curl in a rhythmic pattern, as though practicing some complex task or responding to stimuli the patient was not consciously aware of. When I drew her attention to this, she opened her eyes, looked at the hand, and began to weep. Dr. Blackwood recommended immediate amputation. His reasoning, documented in a letter to Thomas Hartwell dated September 27th, was straightforward. He wrote, "Whatever process is transforming your wife's hand shows no signs of stopping. Indeed, it appears to be accelerating. The hand is no longer simply elongated, but is developing structures and capabilities that have no precedent in human anatomy. If the transformation continues, and I see no reason to believe it will not, the hand will become completely non-functional, or worse, it may begin to affect the rest of her arm or her overall health. Amputation at the wrist, while drastic, would remove the affected tissue and prevent any further progression. I can perform the surgery here at Massachusetts General. It would be quick, and your wife could be fitted with a prosthetic hand that would serve her far better than what that appendage is becoming." Eleanor refused. In a letter to her cousin dated October 1st, she explained her reasoning. She wrote, "Dr. Blackwood wishes to cut off my hand, to remove it as though it were a diseased growth. But it is not diseased. It is not hurt. It is simply different, changing into something I do not understand. I cannot explain why, but I feel that to remove it would be to cut away part of myself, however strange that part has become. Perhaps I am foolish. Perhaps I am allowing sentiment to override reason. But it is my hand, however altered, and I cannot consent to its destruction." So the transformation continued. Throughout the fall and winter of 1890, Eleanor became increasingly reclusive. She saw almost no one beyond Thomas and her mother. She stopped writing letters to her cousin, the correspondence simply ending in mid-October with no explanation. When Margaret Whitmore visited, she found her daughter spending hours sitting by the window, staring at her transformed hand, watching it move through those slow, autonomous flexing patterns that seemed to have no purpose. On December 3rd, 1890, Thomas Hartwell wrote to Dr. Morrison in what appears to have been a desperate plea for help. The letter is brief but revealing. Thomas writes, "My wife has begun speaking to the hand. I came home yesterday to find her in the parlor, holding the hand up before her face, speaking to it as though it were a separate entity. When I asked her what she was doing, she told me the hand wants things, that it has desires and intentions that are not her own. She says she can feel it thinking. I do not know what to do. The doctors offer no help. My wife is not mad, Dr. Morrison. I'm certain of this, but something is happening to her that goes beyond physical transformation. Please, if there's anything that can be done, any treatment or intervention, I beg you to tell me. Dr. Morrison visited the Hartwell home on December 9th. His notes from that visit are the last detailed medical documentation we have of Eleanor's condition. He writes, "I found Mrs. Hartwell in a state of great distress, but not, as her husband feared, insane. She is quite lucid, quite rational, and quite aware of how her statements must sound. But she maintains that the hand has developed a kind of consciousness, that she experiences its movements and what she describes as its intentions as separate from her own will. The hand itself has progressed beyond anything I could have imagined. It now measures approximately 17 inches in length, with fingers so thin and elongated they resemble the legs of some enormous spider. The additional joints I was told about are clearly visible, allowing the fingers to bend and curl in ways that are genuinely disturbing to observe. While I watched, the hand performed a series of movements, the fingers weaving in and out of each other in complex patterns, and Mrs. Hartwell sat completely still, her face expressionless, her eyes fixed on the hand as though she were as much an observer as I was. When I asked if she was moving it consciously, she said no. She said the hand was showing me what it could do. This is where the documented record becomes fragmentary. There are no more letters from Eleanor. There are no more detailed medical examinations. What we have instead are brief mentions in other people's correspondence, glimpses of Eleanor's deteriorating situation filtered through second-hand accounts. Margaret Whitmore wrote to her sister in January of 1891 that Eleanor had stopped leaving the house entirely. Thomas Hartwell's letters to his family in Connecticut, preserved in a private collection that was made available to researchers in 2008, mentioned that his wife spent entire days in the bedroom with the curtains drawn, speaking to her hand, asking it questions, trying to understand what it wanted. On March 14, 1891, Eleanor's 23rd birthday, Thomas wrote to his brother, "She told me today that the hand can hear things she cannot hear, that it responds to sounds or presences in the room that she is not aware of. The fingers will suddenly point in a particular direction or curl into specific shapes. And she says these are signals, communications from the hand to her about things she does not yet understand. I am at my wit's end. The physicians have abandoned us. The church offers only prayers that do nothing. I love my wife, but I am watching her disappear into this thing that has taken over her hand, and I do not know how to bring her back." Then, on May 7th, 1891, Eleanor disappeared. Thomas returned home from work to find the house empty. Eleanor's clothes were still in the wardrobe. Her personal belongings were untouched. There was no note, no indication of where she had gone or why. Thomas immediately contacted the Providence police, and a search was organized. For 3 days, investigators combed through the city, interviewed neighbors, checked hospitals and train stations. There was no trace of Eleanor Whitmore Hartwell. She was found on May 10th, in the woods near the Blackstone River, approximately 3 miles from Providence. She was alive, conscious, sitting against a tree with her transformed hand outstretched before her, the fingers spread wide as though reaching for something. The police officer who found her, a man named Patrick Sullivan, described the scene in his official report. He wrote, "I discovered Mrs. Hartwell in a small clearing perhaps 100 yards from the river path. She appeared unharmed, but was in a state of extreme agitation. When I approached, she did not acknowledge my presence. She stared at her left hand, which was the most grotesque appendage I have ever seen, more like the limb of some creature than a human hand. When I spoke to her, she finally looked at me and said, 'It wanted to come here. It brought me here. There is something in the earth it needs to reach.' Then she stood, allowed me to lead her back to the path, and said nothing more." Eleanor was taken to Butler Hospital, a psychiatric institution that still operates in Providence today, though in very different form than it did in the 1890s. She was admitted under the care of Dr. Edmund Foster, a physician who specialized in what were then called nervous disorders. Dr. Foster's admission notes describe Eleanor as physically healthy but mentally disturbed, obsessed with her transformed hand, convinced of its autonomous agency. She was placed in a private room, and kept under observation. She remained at Butler Hospital for 14 months. During that time, very few people were allowed to visit her. Thomas came weekly, though his letters suggest these visits became increasingly difficult for him. Margaret Whitmore visited less frequently, unable to bear seeing her daughter in an institution. Dr. Foster maintained detailed records of Eleanor's condition, and while many of these records were lost in a fire at the hospital in 1923, some fragments survived and were later compiled into a case study published in the Journal of Nervous and Mental Disease in 1927, long after everyone directly involved had died. According to these fragments, Eleanor remained fixated on her hand throughout her hospitalization. She refused to allow it to be covered or restrained. She spent hours arranging the fingers in complex patterns, watching them move through their autonomous flexing routines, speaking to the hand in whispered conversations that the nurses could not quite hear. Dr. Foster noted that she seemed convinced the hand was trying to accomplish something, complete some task, or reach some goal, though she could never articulate what that goal might be. What makes this period even more disturbing is that the hand transformation did not stop. Even within the confines of Butler Hospital, even under medical supervision, the elongation continued. By the time Eleanor was discharged in July of 1892, her hand had reached its final length of approximately 21 inches, 3.5 times the length of a normal hand. The fingers were so thin and delicate they looked as though they might snap at any moment, yet they moved with fluid grace, bending and curling through angles that defied anatomy. Eleanor was discharged not because she had recovered, but because the hospital determined she was not dangerous to herself or others. She returned to the house on Benefit Street, where Thomas had waited for her, and they attempted once again to resume some semblance of normal life. It did not last long. On September 19, 1892, Thomas Hartwell filed for divorce. The legal documents cite abandonment and mental incompetence, though anyone reading them today can sense the deeper truth beneath the legal language. Thomas had reached the limit of what he could endure. He had married a woman, and that woman had been transformed not just physically, but in some way more profound, into something he could no longer recognize. The divorce was granted on October 28th. Eleanor did not contest it. According to court records, she did not attend the hearing. She signed the papers with her right hand, the normal hand, and returned to her father's house to live with her parents. She lived there for the next 7 years. During this time, Eleanor became something of a ghost in Providence society. Occasionally, someone would report seeing her walking along the river at dusk, her left hand hidden beneath a long shawl. Margaret Whitmore's letters mention that Eleanor rarely spoke, that she spent most of her time in her room, that the hand still moved through its strange autonomous patterns, that Eleanor still watched it with that same fixed attention, as though waiting for it to finally communicate whatever it was trying to say. On January 4th, 1899, Eleanor Catherine Whitmore died. The death certificate, filed at the Providence City Hall, lists the cause as pneumonia, though there are suggestions in family correspondence that Eleanor simply gave up, stopped eating, stopped engaging with the world, and allowed herself to fade away. She was 30 years old. She was buried at Swan Point Cemetery in Providence. The funeral was small, attended only by immediate family. According to her mother's account, Eleanor was buried with both hands visible, arranged across her chest, the transformed left hand clearly visible in its impossible length. Margaret wrote to her sister that she had insisted on this, that Eleanor had once told her the hand must be seen, must be documented, must be part of the permanent record. She wrote, "My daughter believed that someday someone would understand what happened to her. I did not know if she was right, but I honored her wish." Now, more than 130 years later, we still do not understand. Modern medical analysis of Eleanor's case, based on the surviving documentation, photographs, and those plaster casts at Yale, has produced numerous theories but no definitive explanation. Some researchers have suggested an extreme form of acromegaly, a condition caused by excess growth hormone that can lead to enlarged hands and feet. But acromegaly affects both hands, not just one, and it produces thickening and coarsening of features, not the elongation and thinning seen in Eleanor's case. Moreover, acromegaly does not cause the addition of extra joints or the autonomous movements Eleanor described. Others have proposed Marfan syndrome, a genetic disorder that affects connective tissue and can cause long, thin fingers. But again, Marfan syndrome is symmetrical, affecting both hands equally, and it does not progress in the rapid, dramatic fashion documented in Eleanor's case. It certainly does not cause the kind of transformation Eleanor experienced, where a hand essentially rebuilt itself over a period of months into something radically different. A 1996 paper in the Journal of Medical Case Reports suggested the possibility of a teratoma, a type of tumor that can contain various tissue types and theoretically could have stimulated bizarre growth patterns in the hand. But there was no mention of any tumor in the careful examinations performed by multiple physicians, no mass detected, no evidence of the cellular chaos that characterizes teratomas. Perhaps most intriguingly, a 2012 analysis by researchers at Brown University's Warren Alpert Medical School proposed that Eleanor might have experienced a unique form of somatic mutation, a genetic change occurring in the cells of her hand after birth that caused them to follow a radically different developmental program. Such mutations are known to occur, though they usually result in cancers rather than organized structural changes. The researchers speculated that something, perhaps an environmental toxin or an infection, might have triggered stem cells in Eleanor's hand to reactivate and begin growing according to an altered genetic blueprint. But this theory, like all the others, cannot account for the autonomous movements, the apparent consciousness or intentionality Eleanor attributed to her hand, the sense that it was acting according to its own purposes. Because that is the aspect of this case that defies not just medical explanation, but rational comprehension. Eleanor's descriptions of her hand as possessing its own awareness, its own will, its own desires, can be dismissed as psychological response to trauma, as a dissociative reaction to a horrifying physical transformation. But what about the documented autonomous movements, observed and recorded by multiple physicians who watched the hand flex and gesture while Eleanor sat completely still, not consciously directing its actions? What about the incident in the woods where Eleanor claimed the hand had led her to a specific location, that it needed to reach something in the earth? What about the patterns the fingers traced in the air, complex and repeating, as though writing in some language no one could read? These are the elements that push Eleanor's case beyond medical mystery into territory that has no name in our current understanding. Was she experiencing some form of neurological disorder that created the illusion of autonomous movement while her brain unconsciously directed her hand through complex patterns? Were the physicians who observed these movements somehow misinterpreting what they saw, finding intention and consciousness in what were merely random spasms? Or was something else happening, something that our medical science, even with all its advances since the 1890s, still cannot accommodate or explain? The photograph remains. It exists in the archives of the Rhode Island Historical Society, cataloged and preserved, available to researchers who submit the proper requests. I have seen it. I have held it in my hands, that fragile piece of albumin print paper, and stare at Eleanor's face and that impossible hand. Other photographs of Eleanor exist as well, taken at various stages of the transformation, though most remain in private family collections and are rarely seen. The plaster casts at Yale are available for examination. The medical records, scattered across multiple archives, can be pieced together to create a comprehensive timeline of her condition. All the evidence is there. All the documentation exists. And yet, understanding remains impossible. What happened to Eleanor Whitmore cannot be explained by any medical framework we possess. Her hand transformed over the course of approximately 15 months from a normal human hand into something that was no longer recognizably human, something that possessed length and flexibility and structural complexity beyond anything seen in nature. It moved of its own accord. It seemed, to Eleanor at least, to possess awareness. And then, after reaching some final state, some ultimate form, it simply stopped changing, as though whatever process had driven its transformation had completed its work. We are left with questions that have no answers. What caused the initial transformation? Why only the left hand? Why did it progress in the specific way it did, elongating and adding joints and developing that fluid, almost serpentine quality? What was the hand reaching for in those autonomous movements? What did it want in the woods by the river? And perhaps most disturbing, was Eleanor right? Did her hand somehow develop its own consciousness, its own intentions, its own existence separate from her will? These are questions that medicine cannot answer. Science cannot answer them. Perhaps they cannot be answered at all. Perhaps some phenomena exist at the edges of human understanding, in spaces where the rational frameworks we use to make sense of our bodies and our world simply do not apply. Eleanor believed her hand was trying to communicate something. She believed it had a purpose, a goal, something it needed to accomplish. She spent years watching it, speaking to it, trying to understand what it wanted. She died without ever finding that understanding, without ever receiving the explanation she desperately sought. And so the mystery remains. The photograph remains. Eleanor's impossible hand remains, preserved in that single moment of captured light, reaching forward from 1890 into our present time, offering no answers, only questions that will probably never be resolved. If you found this case as fascinating and disturbing as I did, if you want to explore more historical mysteries that challenge our understanding of human biology, of consciousness, of the strange and inexplicable events that sometimes occur at the margins of documented history, then stay with this channel. There are more stories like Eleanor's, more cases that have been buried in archives and forgotten by time, more evidence of impossible things that actually happened to real people in documented circumstances. The past is full of mysteries. Some of them are waiting to be rediscovered. Some of them are waiting to be understood. And some of them, like Eleanor Whitmore's hand, may remain forever beyond our comprehension, permanent reminders that the world is stranger and more mysterious than we can ever fully know.